Yeah, hi, I'm Dr. Sunil Reddy, consultant neuropsychiatrist at Himagiri Hospitals, Gachibowli. Here we are going to know about cranial stimulation therapy for stress, anxiety, depression and insomnia too. So why we are discussing about this therapy, new techniques, cranial electrotherapy stimulation is a very new therapy in Hyderabad. Like for usually as a psychiatrist we prescribe antidepressants, electroconvulsive therapy, rtms for anxiety and depression, but nowadays people are not accepting the therapy, therapy means like a drug treatment, because they have obviously their own side effects like erectile dysfunction and sexual dysfunctions as well. So people are going for a non-medical treatments like alternative therapies like neuromodulation techniques. So in that this cranial electrotherapy stimulation is somewhat different and very mild. Of course it takes sessions, it takes long time, but it gives very immense relief from their stress and anxiety, and it improves your sleep too, without any medications. Like usually for sleep we give benzodiazepines, lot of benzodiazepines. There is always a possibility of addiction. So obviously we as a psychiatrist I avoid most of the benzodiazepines for sleep. But other than benzodiazepines they use antidepressants too. So antidepressants has their own side effects like weight gain probably, and of course sexual dysfunctions. To avoid this chemical recovery or medication recovery of stress and anxiety and depression, it's a very new technique without any side effects. So side effects means like for a cranial stimulation there won't be any side effects. We usually give it to earlobe. So we connect the probes to earlobes, not to the brain or head. Usually for electroconvulsive therapy, ECT is something different from cranial electrotherapy stimulation. So cranial electrotherapy stimulation is for earlobes. From there it stimulates the thalamus of the brain. So it regulates the neurotransmitters, like it produces happy hormones, and it relieves your anxiety and depression. And giving particularly we have to go with certain sessions so that their anxiety or depression, even it improves your sleep too. So how it goes, the science behind the cranial stimulation is, so previously in Indian history we used to hold our earlobes to stimulate our brain. The same thing now they are following in Western countries, like stimulating the brain thalamus by giving simple low potency electric shock to the earlobes to activate the neurotransmitters in the brain. So that's a similar mechanism, but we use here completely new devices which we can adjust the electrical stimulation by adjusting the knobs and give you a simple shock. Yeah, it's an electric shock, simple low potency electric shock to stimulate your brain cells to produce happy hormones to relieve your anxiety and depression. So how much time it will take? Yes, obviously even with medication also it takes 3 to 4 weeks. For this obviously it comes down like 1 to 2 weeks. So it relieves symptoms within a very less time without any side effects. Hopefully you use it and get better from your depression and anxiety. Thank you.